Welcome. Today you will learn how to check the blood pressure of a patient. On your left, there is a screen which shows the steps and your progress. In a real clinic, you will begin by introducing yourself, explaining the procedure, and then give the patient time to ask questions. This is not part of this simulation. The objective of this simulation is to teach you how to properly check a patient's blood pressure. This includes understanding the basics of blood pressure, sanitizing your hands, applying the blood pressure cuff, placing the stethoscope, inflating the cuff, and correctly identifying systolic and diastolic pressure. While this simulation is a valuable learning tool for understanding how to check a patient's blood pressure, it alone does not qualify you to become a registered nurse. Becoming a registered nurse requires a degree from an accredited nursing program, passing the national licensing examination, and fulfilling all other licensing requirements in your state. Practical experiences like this one are part of the curriculum, but there's a lot more to learn. The average salary for a registered nurse can vary greatly depending on factors such as geographical location, years of experience, and specialization within the field. However, according to the U.S. Bureau of Labor Statistics, the median annual wage for registered nurses was about $75,330 in May 2020. You may want to look into specific data for your area or intended specialty for more accurate information. The hand sanitizer is near the bedside table. You should see it in the same general area as the stethoscope and blood pressure device. Blood pressure is measured using two numbers. The first number, called systolic blood pressure, measures the pressure in your arteries when your heart beats. The second number, called diastolic blood pressure, measures the pressure in your arteries when your heart rests between beats. High blood pressure, also known as hypertension, can lead to several health risks if not managed properly. These include heart disease, stroke, kidney disease, and even heart failure. It's often called the silent killer because it usually has no symptoms until it causes damage to the body. Regular monitoring of blood pressure is crucial for early detection and management. This procedure is carried out to make sure that the blood pressure is monitored for heart health status and detect any potential issues. In this simulation, Sarah is having a routine blood pressure check at her doctor's clinic. Next, the patient is asked for their first name, last name and date of birth, to verify against their records that it is the correct patient. Apply the sanitizer to sanitize your hands. Wrap the blood pressure cuff over the patient's right hand. Please ensure that the blood pressure cuff is wrapped around the arm, neither too tight nor too loose. Make sure the patient is sitting in a comfortable position. Place the stethoscope over the brachial artery, which is highlighted with a red sphere. Grab the inflation bulb and squeeze it to inflate the cuff until it is inflated to approximately 200 millimeters of mercury. The appropriate inflation pressure for the blood pressure cuff is usually around 200 millimeters of mercury. However, this can be influenced by factors such as the individual's typical blood pressure range, their age, and any existing health conditions they may have. It's always important to inflate the cuff until the radial pulse disappears and then inflate an additional 20 to 30 millimeters of mercury. This ensures that the systolic blood pressure will be accurately measured. Systolic blood pressure is the top number in a blood pressure reading. It measures the pressure in your arteries when your heart beats, that is, when the heart muscle contracts. It's an important aspect of determining overall heart health. A normal systolic blood pressure is typically below 120 millimeters of mercury. Use the air release valve below the inflation bulb to release the air. The air release valve is a part of the blood pressure device. It's used to slowly let the air out of the cuff after it has been inflated. By carefully controlling the speed of this release, we can accurately measure both the systolic and diastolic blood pressure. You'll want to use it after you've inflated the cuff to approximately 200 millimeters of mercury. Use the bulb again to continue letting out air. Diastolic blood pressure is the lower number in a blood pressure reading. It represents the pressure in the arteries when the heart is at rest between beats. It's an important indicator of heart health, with a typical normal value being less than 80 millimeters of mercury. Utilize the red sphere to remove the cuff and the stethoscope and place it on table, once the air is deflated from the cuff. Next, you would answer any of the patient's questions and document procedures and findings in accordance with facility policy. Yes, there are both medicines and medical conditions that can affect blood pressure readings. Certain medications such as beta blockers, diuretics, and ACE inhibitors are used to lower blood pressure and can therefore affect readings. Similarly, medical conditions like hypertension, heart disease, and kidney disease can cause higher blood pressure readings. Other factors such as stress, diet, physical activity, and alcohol consumption can also influence blood pressure. Therefore, it's important to have a holistic understanding of a patient's health and lifestyle when interpreting blood pressure readings. Great. You have done a good job at checking Sarah's blood pressure, and remember, these regular checkups help us ensure our health is in top shape. Now it's time for a quiz. The patient's systolic pressure level is 120 millimeters. The patient's diastolic pressure level is 60 millimeters. This simulation aims to guide you through the steps of measuring the blood pressure of a patient. This has been an example of a blood pressure simulation. Feel free to go through the experience again or go back to the homepage and try a different experience.